After that, ये very settled. So we have discussed about the soil, we have discussed about the seed. Next would be sowing the seed. So we will be showing a video to you. So there are two methods. Now you can see this is a large fat volume. If you have to inject in a large area, for example in breast, so we will use a bag, and this is the gravity segmentation. Fat is on the upper side and the luminescent fluid and blood goes down. Okay, so this is the simple method of fat preparation instead of going for that centrifuge that does cause trauma to the stem cells. However, studies have shown that all methods of preparation are equally effective. This method is simple and doesn't require any specialized centrifuge machine. Though we all have those machines, but this causes less trauma to the stem cells. Next, we get it. Next. Sowing seeds, putting the graft. So there are two methods. You can see this is a large volume, large size range, this is small range. But you should always sprinkle with precision. I always say that a painter is just making a stroke of a brush, gently making a stroke of a brush. It is just, you keep on moving your syringe while you keep on injecting. So there is continuous movement while you are injecting. There is a fine balance of injecting, and this balance is very important. And always try to use smaller size syringes because they provide more precision. If God forbid you just press it hardly, there will be small amount, just 1 cc of the fat, you can easily mold it. So always try to use small size syringe and no two motions in the same direction. And the coordination should be such that you should not be putting more than 0.5 ml, 0.1 ml per cc of the area. So this is how you can gently use the pleasure of the syringe in a small motion. So this we are injecting in the upper lip. You can see that it is being injected gently in small amounts. The next, support post-graft care. As the crop needs fertilizers, so what is the post-graft care? Is that you need to immobilize it. For phase, for example, you can always use neurotoxin to immobilize it, or you can ask the patient not to use the muscles of mastication which are underneath, so that the take of the graft is better. Next, still, if we follow all these things, I do follow. There are many surgeons sitting here who would be using fat grafting, but still there is absorption of about 40 to 80%. In my experience, with all these techniques, still 30% of the graft absorbs. Okay, so why does that happen? Next. So you can see in this picture, so fat graft is being vascularized from the sides. Okay. So the bigger this size would be, the difficult it would be from the sides to vascularize the graft. Okay. So this is a large globule of the fat, and you can see it is being vascularized from the sides. So this center would necrose, but the surroundings would survive. So this is a micro ribbon where we have just made like a stroke of a brush, just 0.1 ml per cc, and this is a large ribbon. So this fat would be not be surviving. Next. So basically there is a theory behind it. There are 3 zones. As vascularization would be from the surroundings. So this zone would survive. This zone would definitely die. But what about this zone? This zone is a borderline zone. If it would contain more stem cells, because stem cells are resistant to ischemia ischemia or hypoxia. So this would survive if there would be more stem cells, but otherwise it would not survive. Okay. Next. So you can see one of my patients where we have done fat grafting, but it absorbed over time. Next. So the commonest solution which we employ in these patients was regrafting. We usually ask the patient that we would have 3 or 4 sessions of fat grafting. This is the first session, after first session, then after maybe 2 or 3 sessions. So this is what is most commonly employed for treatment of such patients. Next. But there is a shift now, as Fridun has told you, stem cells. Okay. So 50% of fat tissue is adipose tissue derived stem cells. If we harvest fat, 50% of these cells are stem cells. Next. So our research question was, does supplementation of the fat grafts with adipose tissue derived stem cells improve survival? That is called cell-assisted lipotransfer. Next. So basically there are 2 components. One is SPF, as Professor Fridun has already told you. Cell-assisted lipotransfer is one is SPF that contains about 5 to 6% of the stem cells, and there are other cells also. Mind it that in SPF there are cells which cause inhibition of surrounding regeneration. So it is a two-edged sword. It can enhance or it can decrease. Okay, but overall the response of SPF is always better. Next is pure cultured stem cells. What is the difference we will see next? So this is SPF, Professor Fridun has already told you. It contains different cells, stem cells, progenitor cells, mature cells. Few of these cells are inhibitory cells, but overall the balance is more towards regeneration. Okay. Next. But this is ex tissue expanded stem cell that you aspirate, then you prepare SPF, and from that SPF, adipose tissue derived stem cells are separated and then they are grown in culture, and then there are certain markers. Now these would be pure population of stem cells. There are ethical issues with this. We are currently not using this. We use this for our study as an experimental model after taking consent from the Pakistan Punjab Human Organ Transplant Authority. But this is not being allowed, this expansion. But probably this would be the future. Next. So this is the silver bullet which we have found. Next. So we did a study, and we have found that enrichment with adipose tissue derived stem cells increases the survival of the fat graft, and the need for regrafting is decreased. The result we achieve with 3 or 4 sessions is achieved with a single session. Next. This was basically the outline of our study. This was basically conventional fat graft where we did multiple sessions of fat grafting, and this was basically where we harvested the fat, we expanded the stem cells, and then we re-injected the fat plus stem cells. And then we did assessment. There were different methods of assessment. Next. Next. So these were the few representative cases. Next. This patient had this contour deformity. We did 1 session, then we did 2 more sessions, and this was the final result after 1 year. But this was with 3 or 4 sessions. Next. This patient again I have shown you a severe case in which we did multiple sessions, and this was the result after multiple sessions. Although she underwent bony correction later on, but this is what we achieved with fat grafting. Next. So this was our first patient of stem cell group where we did, and this is the result. Rather than, I always say that there is probably overgrowth. You can see. So this is the result with single session of stem cell, and this is about 1 year follow-up. Next. Again, this patient had a single session of stem cell plus fat grafting. Next. Again, this patient has this contour deformity, and we did single session. Next. Again, this patient has this contour deformity, and we did single session, and this is follow-up after about 2 years. Next. Now, the problem with this ex vivo expanded stem cells is that once you put cells in a dish, it becomes unethical. We are not allowed to use something from the lab until it is being done experimentally. So nowadays what we are doing is that we are using this cocktail. This term is very popular these days. PRF, platelet rich fat. Very popular. what we did was, what we are doing nowadays is that we harvest microfat, we prepare nanofat from it, we mix nanofat with microfat, and we prepare PRP and we inject it. The theory behind this is that for stem cells to grow in the lab, we need PRP. So if we can mix PRP with fat in vivo, that should have the same effect. Okay? So this is the cocktail which we are using clinically these days, for which we don't require any lab processing. Next. We found stem cells to be effective, though there are ethical issues with expanded stem cells. But now what we need to do is, next studies would be to find the adequate number of stem cells. What should be the adequate number? Should it be 10 raised to power 9, less than that, more than that? That would be answered in future studies, only experimentally. But practically, you should be using fat graft plus nanofat plus PRP to increase the survival of the fat graft. Next. These are the few references from where I have tried to prepare my presentation, from where I have taken the material, the survival of the fat, and rest of the things. Next. Thank you very much for your patience.